Welcome to the NC Choices webinar series, Teaching Tools for Beginning Farmers, funded by the United States Department of Agriculture's Beginning Farmer and Rancher Development. I am Heather Glennon, Assistant Professor at the University of Mount Olive, and I am going to present the module on small ruminant production. This is one of 7 modules offered in this webinar series. In this presentation, we'll talk about small ruminant health. If you are interested in the other resources offered by NC Choices, you can find out more on our website or on our YouTube channel. Welcome to the small ruminant health presentation for beginning farmers. This PowerPoint will cover the normal animal, administration of medication, internal and external parasites, and other common health concerns. Before a producer can determine if an animal is sick, he or she must first know what is normal. One of the most important tools in your medicine box should be a thermometer. If an animal is lagging behind others or has a lack of appetite, the first thing to do is take its temperature. Normal temperature is between 101.5 and 103.5 degrees Fahrenheit. If the temperature is elevated, it could be indicative of an infection. A normal animal will take 12 to 15 breaths per minute, have a heart rate of 70 to 80 beats per minute, and ruminate at least once per minute. Animals should be checked at least once a day. There are several things to note during the daily observation. Starting in the front, is there a discharge from the nose or eyes? This could be indicative of a respiratory problem. A heavy load of internal parasites can lead to anemic eyes or white eyelids and swelling under the jaw, which we also call bottle jaw. An infestation of external parasites can lead to a rough hair coat or patches of hair missing. By running your hand down the back of small ruminants, you can determine the body condition score. If it is not ideal, you will need to adjust the ration. Another place to look is the hind end. Does the animal have a dirty tail or diarrhea? Diarrhea is a symptom of many different diseases such as parasitism, bacterial infections, or an imbalance in nutrients. If the ewe or doe is lactating, take a look at the udder. Does it seem hard, swollen, or hot? If one side is bigger than the other or lumpy, she may have mastitis. As the animal walks, take note if it's limping. It may have sustained an injury, have foot scald, or need to have its hooves trimmed. Vaccines and medications can be administered in several ways. Oral solutions can include dewormers, antibiotics, and nutritional supplements. External parasites are treated topically with a liquid or a dust powder over the animal's back. Vaccines, antibiotics, and other compounds can be administered by injection, either in the muscle or under the skin or intravenously. Intramuscular injections should be administered in the neck muscle. See the triangle in front of the shoulder. IM injections should never be given in the rump. This can lead to bruises or abscesses in the most valuable cuts of meat. IM injections are absorbed from the bloodstream quicker than subcutaneous injections. Subcutaneous injections are administered under the skin, generally in the loose skin between the neck and shoulder, behind the elbow, or in the armpit area. Pull up the loose skin and make a tent, then inject the needle into the base of the tent. Be careful not to go through the other side. Intravenous injections administer medication into the jugular vein, where it will spread to the body tissues very rapidly. Animals experiencing milk fever may need IV calcium. This is the most difficult injection technique and is usually administered by or under the direction of a veterinarian. You may also need to provide IV fluids in cases of severe dehydration. Gastrointestinal parasites are the biggest threat to pasture-based small ruminant production in North Carolina due to the hot, humid weather. Parasites cause decreased growth and milk production because they steal the nutrients from the animal. Animals with heavy worm loads are lethargic and have decreased feed intake. Handling and treating sick animals with Anthelmintics or dewormers is costly in labor and product costs. High death losses can be seen especially in younger or older animals with lower immunity. Animals in a herd or flock vary in their susceptibility to parasitism. Those that are more susceptible to getting sick include females in late gestation and early lactation, newly weaned young stock, and older thin animals. Stress and lower planes of nutrition will increase susceptibility to parasitism. Overconditioned pets or non-productive adults can withstand a parasite infection much better. Research has shown that 20% of your herd expels 80% of the parasite eggs on your pasture. If you can identify those repeat offenders and cull them, it will decrease pasture contamination and keep your animals healthier in the long run. Internal parasites steal nutrients from the animals, causing weakness, decreased appetite, and weight loss. The Hormonchus contortus worm sucks blood and causes anemia and bottle jaw. Anemia can be checked by pulling down the animal's bottom eyelid. Bottle jaw is an accumulation of fluid under the jaw. Immediate treatment is needed in order to try and save the animal's life. If gastrointestinal parasites go unchecked, high death losses can occur. Trichostrongyle type gastrointestinal parasites live in the abomasum or the small intestines of small ruminants. The adult females lay eggs which are expelled in the feces of the animals. If the eggs in the feces are exposed to the correct temperature and moisture, they will hatch and go through 3 larval stages on the soil surface. Infective larvae, or L3s, can move 2 to 3 inches up the grass blades in dewdrops. The animals will then ingest the infective larvae as they graze. This could take approximately 4 to 10 days under ideal conditions. Once inside the animal's GI tract, the larvae develop into adults, breed, and start laying eggs. The larvae could go into hypobiosis or arrested development during extremely cold or dry periods. The Barberpole worm, or Hormonchus contortus, causes the most damage to small ruminants in the southeast. They live in the abomasum and suck blood. Females can also lay thousands of eggs per day, leading to high pasture contamination. Their short life cycle of 21 days allows animals to reinfect themselves during the summer months. Producers who utilize rotational grazing may be unknowingly exposing their animals to high loads of infective larvae if they regraze the same paddocks every 3 to 4 weeks. There are many other trichostrongyle type gastrointestinal parasites that cause diarrhea as opposed to anemia. These parasites are more prevalent in the cooler months, but are typically seen in mixed infections with Hormonchus contortus worms. Diarrhea leads to dehydration, which can ultimately lead to death. Tapeworms are often seen in younger weaned animals. They live in the small intestines and absorb nutrients, resulting in thin animals. Unlike the microscopic trichostrongyle type eggs, segments of tapeworms can be seen in feces with the naked eye. They look like small pieces of rice. Tapeworm eggs are eaten by pasture mites and then ingested by grazing animals where they complete their life cycle. Most animals will not die from a tapeworm infection, but will have decreased weight gain and feed efficiency. Your veterinarian may suggest deworming with a dewormer such as Valbazen, Safeguard, or Panacure. While all animals carry a natural population of the protozoa Eimeria, coccidiosis can be seen in young or just weaned animals and kids. Stressful conditions cause the animals to shed large numbers of oocytes, resulting in dark, bloody, smelly, watery diarrhea. Animals will become weak, dehydrated, and lose weight. The lining of the small intestine can be damaged permanently in severe cases. Animals that are kept in unsanitary conditions or that eat or drink out of contaminated buckets are more prone to getting coccidiosis. The best prevention against coccidiosis is clean, dry facilities, but some producers choose to offer a feed containing a coccidiostat that limits the shedding of the oocytes. Bovatec, Rumensin, and Decox are commonly added to sheep or goat feed. Other products, such as Corid, are commonly added to water or given as a drench under the direction of a veterinarian. Research has shown that animals eating Lespedeza have lower incidences of coccidiosis due to the tannins in the forage. Scouring animals will benefit from fluids and electrolytes in addition to the chemical treatments. Dewormers, which are also called Anthelmintics, are used to treat gastrointestinal infections. There are 3 classes of these chemicals that have different modes of action in killing the worms. The first and oldest class is the benzimidols. These thick, white liquids include products like Panacure, Safeguard, and Valbazen. Because they have been overused and or misused, worms have become largely resistant to this class. The second class, the macrocyclic lactones, include products like ivermectin and Cydectin. Cydectin is a newer and more powerful product than ivermectin and to date is more effective, although there have been documented cases of Cydectin resistance also. The third class, the nicotinic antagonists, include products such as Positive Pellet, which is administered as a feed, and Prohibit, which is a drench. While many of these medications have large safety of margins, death can occur from an overdose of Prohibit. The product should always be mixed and administered according to the label or to your veterinarian. Many of these dewormers are not labeled for small ruminants, so guidance from your veterinarian is warranted. Extra label drug use can allow a producer to use a medication in a manner different than stated on the label. This can include different dosages, durations, species, diseases, or route of administration. Your vet should determine a proper dosage and slaughter withdrawal time. It is important to have a VCPR. That is a veterinary client-patient relationship. Most dewormers are administered as an oral drench. After properly restraining the animal, place the metal dosing tube over the animal's tongue so that the dewormer goes directly down the throat. There are 2 ways to check your animal's parasite load. A fecal analysis can be performed by a trained professional or veterinarian, but this can become time-consuming and expensive. Another option is FAMACHA scoring. A producer can catch their animals every 3 or 4 weeks and check the level of anemia in the lower eyelid. Animals with pale pink or white eyelids would need to be treated immediately. Records should be kept to identify animals that are continually pale. These animals should be culled as they will pass those genes on to their offspring. So if we look at the FAMACHA card on the screen, on the left we see a bright red square. That is a score of a 1. Those animals are very healthy. As you travel to the right, there is a very white block on the right-hand side. That would be a score 5. Those animals would need to be treated immediately. Generally, animals that score 1 or 2 are healthy, and animals that score 4 or 5 are unhealthy. Those animals that would score a 3, having a pale pink eyelid, are questionable. You would need to take a look at the animal and assess its body condition score and stage of production before determining if it needed to be treated. Many small ruminant specialists and veterinarians have researched alternative parasite treatments as part of the American Consortium for Small Ruminant Parasite Control. Their work can be found on the website wormx.info. The use of copper oxide boluses have proven effective in controlling the barberpole worm, especially in young lambs. Research has shown an approximate 50% decrease in parasite load when used in goats. 2-gram and 4-gram boluses are now commercially available for goats. While copper sulfate can be toxic to sheep, the oxide form of copper is less available and poses little threat when dosed once or twice a year. Sericea lespedeza is a perennial, warm-season legume that grows in acidic soil with low fertility and can tolerate drought well. It can be fed as a fresh forage, as a hay, or in the pelleted form. Research has shown that in order for it to be effective against the barberpole worm, it should make up at least 50% of the daily dry matter intake. The condensed tannins in the forage is responsible for the decrease in blood-sucking and egg-laying activity of the adult worms. Lespedeza should be planted in March or April and not grazed during the establishment year. It grows well in North Carolina from April through September. Producers can implement several grazing management practices to reduce parasitism. First, don't allow animals to graze forages below 3 to 4 inches. Infective larvae are found in the first few inches of the plant. You can also increase the amount of time between grazing events. This could be accomplished by rotational grazing or making hay in between grazing events. You could incorporate tannin-rich forages, such as Sericea lespedeza, into your pasture system. Certain browse species also have higher levels of tannins. When animals are grazing in woodlots, they are not grazing close to the ground, so they are less at risk to picking up larvae. And finally, increasing forage quality, especially the protein level, will help your animals fight off a parasite infection. Up to this point, we have only discussed internal parasites. But sheep and goat production can be diminished by external parasites as well. Lice and mange mites are just a few parasites that live off the blood of the host and lay eggs on the hide. Animals will be itchy, rub on things, and can lose wool or hair. External parasites can also cause respiratory distress and transmit disease. Keds, lice, ticks, mange mites, nasal bots, and blowflies can all affect small ruminants. This picture shows blowfly larvae that have hatched from eggs laid in dirty and wet wool. They will feed directly on the skin and cause wool loss and skin infections. Many producers will treat sheep after shearing with a topical chemical or a dip. It is best to treat twice, 2 weeks apart, to kill any eggs that have hatched since the first application. Lice is very common during the winter months when animals are housed close together. Animals that are affected with mange mites may have patches of hair missing around the eyes and ears, inside the legs or scrotum. Lesions and thickened skin will follow if not treated with a spray, dip, pour-on, or dust. For more information about parasite control in small ruminants, please see the following website, www.wormx.info. This is the go-to place for information about controlling internal parasites in small ruminants. Mastitis is an inflammation of the udder of a lactating animal caused by a bacterial infection. Milk production will decrease, causing nursing kids and lambs to have lower weight gains. Mastitis can be caused by unsanitary conditions or a teat injury caused by nursing young stock. A swollen, red, or hot udder half are obvious signs, as well as moms that will not allow their lambs or kids to nurse. You should inspect the teats for injury from kids or lambs and watch to see if the kids and lambs nurse regularly. Abscesses or lumps may form in the udder, as in the picture on the left. Gangrenous mastitis causes tissue destruction and most often death, as pictured on the right. Clinical symptoms of mastitis include swelling, heat, redness, hardness, pain, and flakes or clots in the milk. The first sign may be fever, animals off feed, or depressed. Some animals will have subclinical signs and be healthy other than having lumps in the udder. Milk-producing cells are being destroyed and production may never be at 100% again. That is why it is important to note any trace of mastitis. Because there are many different organisms that can cause mastitis, it is best for a veterinarian to culture the milk and then prescribe the correct antibiotic. Mastitis can be treated with an intramammary injection or a systemic antibiotic injection. Something to consider is how are you going to keep kids or lambs from nursing a female that has been treated with an intramammary antibiotic. Respiratory diseases can be caused by viruses, bacteria, stress, and weather changes. Poor ventilation can lead to dust and ammonia buildup. Animals may go off of feed, be depressed, or have a temperature over 104. You may notice nasal discharge or labored breathing. And then again, you might just find a dead animal in the pasture. All of these can be signs of a respiratory ailment. Contrary to what you might think, pneumonia is actually quite common in the summer months. To treat pneumonia, a producer can do the following. Bring the animal indoors or under shade and keep them cool. Treat with the correct antibiotics, provide anti-inflammatory drugs, pain relievers, and fluids. It is best to talk to your veterinarian. If you carefully observe your animals every day, you will be able to pick up abnormal behavior and treat as soon as possible. Animals that are not stressed and that are on a high plane of nutrition are less prone to getting sick. Trace minerals, especially copper, selenium, and zinc, can increase immune function. A pneumonia vaccination is commercially available at less than $1 a dose. Ewes and does in late gestation that are not being fed adequate energy in their ration are at risk for pregnancy toxemia before delivery or ketosis after delivery. Toxemia ketosis is caused by a buildup of excess ketones in the blood due to incomplete metabolic breakdown of body fat. Basically, low blood sugar would cause this. Most fetal growth takes place during the last trimester of pregnancy. Animals that are too thin, too fat, or carrying multiple fetuses can be affected. An energy-dense diet is recommended due to limited space within the animal to hold feed. Soon before or after kidding and lambing, high-producing females are susceptible to milk fever, which is low blood calcium. The calcium requirement could double during late pregnancy. Females are unable to resorb the calcium needed from her bones or absorb it from her diet. Can be seen 6 weeks before freshening or up to 10 weeks after freshening. Animals will be unable to stand and may need intravenous calcium. There are a few over-the-counter oral calcium products that could be used to treat milk fever. Adding legumes or limestone to the diet after delivery can provide supplemental calcium. And remember, diets that are high in grains are going to be low in calcium. Foot scald is a common condition that causes lameness in animals on pasture during wet periods. The bacteria, Fusobacterium necrophorum, found in the soil, damages the soft tissue and causes inflammation and a foul smell between the animal's toes. You may often notice your animals grazing on their knees or limping. Treatment of foot scald includes applying copper sulfate or zinc sulfate topically or in a foot bath. Injectable antibiotics may be prescribed in severe cases. Placing animals on drier land, trimming their hooves and hair from around the hooves may help. Chronic limpers should be culled. Foot rot is caused by an interaction of two anaerobic bacteria, Bacteroides nodosus and Fusobacterium necrophorum. Affected animals become lame and the area between the toes becomes moist and red. The erosion of tissue between the sole of the toe and the outer hoof characterizes foot rot. Treatment is the same as for foot scald. A vaccine is available for sheep. Again, animals that are chronic limpers should be culled. White muscle disease is caused by a selenium or vitamin E deficiency. It is seen mostly in newborn and fast-growing kids and lambs. If skeletal muscles are affected, animals may have weakness in their legs and not be able to stand at all. If cardiac muscles are affected, animals may appear to have pneumonia-like symptoms. Many soils in North Carolina are selenium deficient, resulting in selenium deficient forages. Providing supplementation in the form of minerals to animals on pasture or as an injection are recommended to pregnant females or newborns. Enterotoxemia, also known as overeating disease, is a condition caused by Clostridium pharyngens type D. These bacteria are normally found in the soil and also in the digestive system of sheep and goats. When animals are exposed to a sudden change of feed or large quantities of carbohydrates, these bacteria can rapidly reproduce in the animal's intestines, producing large quantities of toxins. Young animals are most susceptible. Diarrhea, lack of appetite, and sudden death may occur in lambs and kids. Vaccination of pregnant females 1 month before delivery and vaccination of kids and lambs at weaning is recommended. Urinary calculi, phosphate saltstones, affect intact and castrated males by blocking the urinary tract. If not treated, the bladder can burst and the animals can die. Males that are castrated early or males that are on high-grain diets are most susceptible. Adding legumes and ammonium chloride to the diet can help prevent blockages. Making sure that the animal has adequate water intake is also essential. Caseous Lymphadenitis is a highly contagious disease caused by the bacteria Corynebacterium pseudotuberculosis. It manifests itself as abscesses that form near lymph nodes or internal organs. When these lesions drain, they contaminate the environment and can stay in the soil for years. It can be spread by nasal discharge or coughing. Gloves should be worn when handling these animals as it is zoonotic. There is currently no cure, but there is a vaccine available for sheep if your flock has a history of the disease. Contagious ecthyma is an infectious virus in the pox family that causes sores on the lips of young animals and teats of nursing moms. Because it is a painful condition, animals have decreased feed intake, resulting in weight loss. This will also stay in the soil environment for years. Soremouth or ORF usually resolves itself in several weeks. A live vaccine is available for use if your herd or flock has had problems in the past. Gloves should be worn when handling these animals as it is zoonotic.